This is cortisol, and it's a steroid, not an anabolic steroid, it's a glucocorticoid. And in conjunction with the sympathetic nervous system releasing norepinephrine, cortisol is released from the adrenal glands as a primary stress hormone to aid in fight or flight. So it helps to increase blood pressure, raise blood sugar, increase heart rate, and reduce inflammation by suppressing your immune system. And by the way, cortisol and hydrocortisone are the exact same thing. Cortisol is just made in your body, and hydrocortisone is just the synthetic pharmaceutical version. In a world where Chads are getting frame mogged and attempting to preserve their hairline, it's important to remember that we need cortisol spikes to live our lives. If you don't know what I just said, it's like Zoolander in real life, but we need cortisol spikes. And the main reason being cortisol is the primary hormone that's responsible for waking you up in the morning. As you can see, there's this very prominent cortisol spike in the morning, the cortisol awakening response. And this is why it's important to adhere to a sleep schedule. That way your circadian rhythm can continue to yield the cortisol spike at the same time in the morning. And this way, when you're getting proper sleep, you don't have to compensate for your energy levels by having cortisol spikes in the middle of the day. Now, some people don't even have the ability to produce their own cortisol, and that's because their immune system attacked their adrenal glands, and this is called Addison's disease. So no cortisol means chronically low blood pressure, low blood sugar, low sodium in the blood, constantly getting fevers from an unchecked immune system, and this results in severe dizziness, vomiting, and diarrhea. Former President John F. Kennedy actually had Addison's disease. Fortunately, the treatment's pretty straightforward. It's hormone replacement therapy. We've got hydrocortisone tablets for the glucocorticoids, and fludrocortisone, a mineral corticoid to help retain salt in fluids. And then we have the opposite end of the spectrum, where we have chronically elevated levels of glucocorticoid in the blood, and this can result in Cushing's syndrome. And this is usually caused when somebody is taking a glucocorticoid like hydrocortisone or prednisone for an inappropriately prolonged amount of time. We're talking months and months. This is why pharmacists will usually counsel a patient to discontinue a glucocorticoid after a few weeks. If anything, we're going to taper down the dose. And if this is not the case, then we might be dealing with a tumor in the pituitary gland, and this could actually be a case of Cushing's disease. Signs and symptoms include weight gain and fat distribution, particularly around the face and between the shoulders and the neck. They call it like a buffalo hump. We've got centrally at the abdomen. We'll end up getting some thin skin as well as some acne. We'll get some chronic fatigue and muscle weakness, as well as a predisposition to osteoporosis. We'll get chronically high blood pressure and blood sugar, potentially causing type 2 diabetes. Get depression, anxiety. If you're a woman, you might notice some excessive facial growth, call it hirsutism. If you're a man, we might get some decreased libido, erectile dysfunction. It doesn't sound fun. So for some patients with Cushing's disease that aren't a good candidate for surgery to get that pituitary tumor removed, fortunately, we have a pharmacotherapy. So this is Isturisa, which is the brand name for osilodrostat, and it is a 11-beta hydroxylase inhibitor. And the mechanism's pretty straightforward. We're just blocking one of the enzymes that's involved in the synthesis of cortisol. And the directions are usually pretty straightforward too. It's an oral tablet, and it's usually taken 1 tablet twice a day. So, public service announcement, prioritizing high-quality sleep is probably the #1 way to directly regulate your body's natural cortisol rhythm. And be wary of marketing trying to use your cortisol against you. And if you truly are concerned about hormone dysfunction, talk with your medical team. Endocrinologists have evidence-based techniques for assessing your hormone levels. That's it.